we've battled the global pandemic of COVID-19, we've tried to keep you up to date as much as possible. And over those, what I called a long, dark winter, we've asked much of you at times. We've asked for sacrifices, whether it be businesses or families. And we've asked an awful lot of a group that is incredibly special to all of us and important to the state's future. That's our students. You're going to hear from a student. You're going to hear from educators across Minnesota as we recognize that this long battle, and I asked a couple times, and I'll talk about this, for us to buckle down and have a goal line stand. Well, we're on offense now, and it's our time to take back the things that make life so wonderful for us, to give those opportunities. And so I'm going to walk you through a little bit here with the goal that it's time to get our students back in school, and we can do that now safely. We have a very robust plan I'll talk you through. You'll hear from Deputy Commissioner Heather Mueller, and then more importantly, you're going to hear from the folks that have made education possible during this time. And I want to be very clear. The sacrifices that were made by students and parents and teachers and administrators and school boards and everyone across this state, learning continued to happen. But we know that the best learning happens when they're in classrooms and when we're with educators in front of them and they're with their peers. And so we're going to take a little time today. I'll walk you through a little bit of this. Again, you'll hear some of the details on this. The good news is going to continue to come. We have made extraordinary progress in COVID-19. We are at case positivity rates that mirror last summer. Some of that is the nature of this virus, but a whole lot of it is because of decisions that you chose to make, whether it be masking or social distancing, or the sacrifices we've especially asked of our students and small businesses to stay in distant learning or to make adjustments. Vaccines are here and they're ramping up. We're doing more than 100,000 doses a week. Even in the midst of a snowstorm, we're doing the best we can to make sure that those are getting out within 72 hours. And because of the hard work of a whole bunch of people, public-private partnerships, partners across this state, from hospitals to pharmacies to Minnesota's public health, we're now getting those out as fast as any place in the country, and it is making a difference. We're on our way to ending the pandemic. I have to say, that's not something that we've been able to say a whole lot. And I was just mentioning to the folks who are in this room, it's usually not delivering the most positive news when we're here. This news is positive. We're beating this thing. We're getting the vaccines out. Minnesotans are responding accordingly, and it is showing. Late in the fall, we predicted it. We knew it was there. The models showed it, that we were experiencing exponential growth. We popped above that line of about 15% positivity where things were going to overwhelm our hospital systems. We've seen this happen across the country. I asked us to dig in, to hold a goal line stand, and we did it. We did not overwhelm our hospitals. Every single Minnesotan who needed care and a hospital bed and the treatments got them, and we kept that as stable as we possibly could. We dialed back to save lives, and we did it, and I said in December, the goal of those dial backs was to stop the surge that would come after the holidays with the vaccines on our doorstep, and we would accelerate into that. And the goal is to start by getting all our K-5 students back in the classroom and to move forward from there. You did it. It's working. This was just an idea of this. And just for now, cases per 100,000, our neighboring states rank first, second, seventh, and eighth in tests amongst cases amongst 100,000 residents. Minnesota ranks 30th. The same thing is true of 7, 8, 17 amongst deaths per 100,000. We are 35th. The sacrifices you made saved lives. The sacrifices you made kept us underneath where we could have been, and the sacrifices you made make sure that more people are going to go back to school, they're going to stay in school, and we're going to open our businesses and keep them open. So new case growth at its lowest level since summer. This is a positive. We know more about COVID. We have more tools to fight it, and I mentioned this last week. It may have a little something to do with cold weather, but Minnesota's use of masking in indoor settings has skyrocketed, and we're now approaching that 90% number that starts to make a difference. And just so you know, CDC talks about that. If we can up from, say, 85% to 90%, they can show us numbers of lives saved. It's a simple thing we can all do, and it makes a difference. Percentage of tests coming back is now below 5% for the first time. That went above 15% in December when hospitals reached 95% capacity, and we were reporting over 100 deaths per day. We reported 2 today. That's 2 too many, but that's the situation that we're in. Hospital bed usage is now back down to almost pre-COVID levels. And again, you see what's happened here. The summer spike that shot us up came back down, and then the fall one that we predicted, and we knew it was coming, and we prepared for it. And those two little spikes you see on the right side, the first one at the top is Thanksgiving, the second one is Christmas. Here's the good news. We had data to show us by the middle of summer that we were going to see a fall spike. We do not see that right now. Now, I want to caution folks, variance and changes in behavior can have an impact on that. But at this point in time, we're doing it. So there's progress. Supply is still limited around vaccines. President Biden and the administration has promised 600 million doses, which the two for that, 300 million doses to the American public by late July or August. The good news is those most vulnerable, 65 and above, we have already vaccinated about 50% of those. We are now seeing almost no cases whatsoever in long-term care facility, and the most vulnerable amongst us are protected by the decisions that you have made and that we have made. We're now up to 943,000. Probably by the time some of this goes to print, by Friday we'll have passed 1 million doses given, basically over a 6-week period. 40% of seniors, that's of today, it'll continue to grow. Educators and child care providers. We have one of 8 states that focused heavily on child care providers and educators for the sole purpose of being here today to be able to safely reopen our schools with a high degree of certainty that with the mitigation measures we will put in place in those schools, with the hard work of local folks who know how to do this, and with vaccines and an only in the nation testing program for educators, we can do this. We're activating that broad network so everyone can get there. How'd we get here? I've talked about this, and you've seen this since last March. It's always a balancing act. Certainly, as we've said, if you want to make sure no one gets COVID, you would make sure you shut everything down. There'd be no interactions among people. That's not possible, practical, and it has its own side effects to it. So we have done things to try and balance, as I've said. We've decided that it wasn't prudent to make sure that everybody got COVID or that our death rate skyrocketed. We made different decisions on that, and we balanced it between the economy and well-being. And when we're seeing progress, it's time to move. And we're seeing the progress in controlling the spread of COVID. We're seeing the progress in the vaccines. It's now time to talk about, we saw a little bit last week with the economy, and now you're going to see this well-being part of it, of getting our students back in school. So students are going to be back in the classroom. Here's what we're going to do. Safe in-person learning is a public health imperative. Last week, the CDC provided the roadmap. The good news is Minnesota's a lot further down that road than even the CDC was. They asked for things that would be nice to have, like testing teachers. We have the most robust one in the nation. They asked for nice to have things, vaccinating educators before they go back. We are already a long ways down that road. And then in addition to providing PPE and doing the things that you're going to hear from the folks who are here, listening to local educators about the unique situation in their own building and their own communities. And Dr. Mueller will have a little bit more on that. Many of our students have already been back. I think you'll hear from superintendents who their K-5 kids have been in all except 13 days since this thing started. It has not hit all areas the same, and our safe learning plan that was developed last July gave that control to local schools to work in conjunction with healthcare providers in the state to provide that safe environment. This simply makes sure that we're taking that one step further. Our expectations is that schools will be able to offer some in-person learning, and my goal is to try and see the best we can to get 5 days a week in all of our schools for all of our students in a safe manner. That's the goal by March 8th. We can do this, Minnesota. The sacrifices we made, the things we've learned, and the efforts we put into it, and hearing from, and you're going to hear from a student to tell you this, we asked a lot. We asked you to give up Christmas in some cases with your family and to not have the big gatherings that all of us wanted to. Well, here's the payoff. We're going to give that present to all of these students because they're going to go back, and you're going to hear from a senior who's going to get a chance to do prom, going to get a chance to do those state tournaments, going to get a chance to graduate, and more importantly, going to get a chance to sit in those classrooms with friends who will remember for the rest of their life. This is a gift that we've done while protecting people's lives. So in-person learning does have some risk to it. I don't want to downplay the fact of this, that we always have to make sure we're mitigating. I will stress it again, and Dr. Mueller will stress it. Our nation-leading on-site testing gives us a huge advantage. We're already above 25% of educators vaccinated, and I'm here to tell you today we're going to bump that to 18,000 doses. We'll go out next week and can try and continue to do that. We will have the bulk of our educators vaccinated by that March 8th deadline, and that will give another added protection. And I want to all the parents listening out there, The educators and those, especially with underlying health conditions and the things we're doing, we're focusing on making sure that we're not spreading. But we also know our students can get it, and there's asymptomatic spread, but we don't want to put them at any unneeded risk too. So we're expanding this testing to allow all students. And again, this is a choice parents can make, but our testing programs are going to be available, whether in-home or at local testing programs focused on 12 to 25-year-olds. Get your kids tested. Mine is an 8th grader and is back at playing club sports, and we're getting him tested after he does this once a week or so to make sure that that's going well. And it is, because these folks are doing the protocols and they're making it work. So we have that expansive capacity that's going to go even further. We listen to folks all over the state, and you're going to hear from them here in just a minute, on the need to get our students back, the need to do it safely. I think the unique thing you're going to hear about Minnesota is the stakeholders across the spectrum, parents, students, teachers, administrators, school support staff, school boards, are all in agreement that we've got a plan, we can do this together. It puts a lot of those decisions in a partnership way of doing it, and it's working, and it has been working for them. So students, we're ready to go. We're going to get back in school, folks. We're going to do it safely. We're going to beat this thing. And I think I've said, and I've been asked on numerous occasions, what do I want to do first thing when this thing is over? I want to stand in a crowded hallway and listen to students laugh with their classmates. That's what I want to do. And that's the work that you've done has enabled us to do that. And this is an exciting day, Minnesota. It's, we're not out of the woods. I don't want to make us believe that there's not some things that we still need to do, but the work has enabled us to do exactly what we wanted to do, control this virus, save lives, and move back to the things that we love.